Hey there everyone, how's it going? Let's go over spleen protocol. The spleen ultrasound is probably one of the easier ultrasounds to do. So it's a pretty small organ. There's only so many pictures you could take of the spleen in sagittal and transverse and coronal. I like to put the patient in right lateral decubitus, so the access to the spleen is much easier. You could also do it in supine. So begin in sagittal. Now, when you're putting the probe longitudinal on the body, naturally, longitudinal, the transducer is going to go up and down like that, right? But when you're trying to get the liver or the spleen through the ribs and you put the transducer in a longitudinal fashion like this, it's going to create a lot of rib shadow. So every rib that the transducer is going through is going to create a shadow over the organ. So instead of putting your transducer in a perfectly longitudinal fashion, put it at an angle. It doesn't have to be perfectly angled because that would be like an oblique. But you're going to have to oblique it a little bit to get a nice longitudinal view of the organ. So I'll begin longitudinal, take a sagittal image. Now you can find a lot of charts online what the normal measurement for spleen ultrasound is. This is the one we use, which is up to 17 years of age. So for spleen, you use the patient's age, and then you'll see the range of that age. So usually anything under 12 from adults is normal. Some places use 13 as the upper limits of normal for spleen. Okay, after you measured your spleen, you can take some medial and lateral images. Always sweep through the entire organ and make sure you get clear views of the dome right under the diaphragm. You don't want to miss any lesions that might be hidden there. It's always good to show the spleen and the kidney interface. You could also use this view to make sure that the echogenicity of the kidney is normal. So medial, lateral. Here you can see the splenic vessels going into the hilum. This is a piece of the pancreas. So here's splenic vein, splenic artery. Good to show the parenchymal blood flow as well. You can use color Doppler. If you use power Doppler, you get much more fill of the spleen parenchyma as well as B flow. Here you can see all the parenchymal vessels. All right, so I measured the spleen here again. It's 11.4. So always try to optimize the view of the spleen so you can get it in the longest fashion so you can get an accurate measurement. After you're done with that, you can do transverse images. I like to go from superior to inferior, just like the kidney or any other organ. So here you can see there's some rib shadowing there. The same thing with the sagittal. When you're in transverse, you're going to want to, instead of going perfectly transverse, leave this part of the transducer a little higher. Nice, clean, homogeneous spleen. You see the vessel there. Here you see the tail of the pancreas. This is a very good view for patients that have pancreatitis. If they're slender enough and you can see this view, you can rule out things like pancreatitis or tumors in the tail of the pancreas. Another thing to consider, quite often you might see a large cystic structure by the pancreas tail or the spleen hilum. This is the stomach. This is not to be confused with a pancreatic pseudocyst or other cystic lesion, although those can be differential diagnoses as well. It's very easy to ask the patient if they had a drink or a couple of glasses of water before the exam, or you could also have them drink to see if the fluid increases, and you also see the swirling of the stomach contents when you're at the left upper quadrant. Oftentimes, the stomach is going to be filled mostly with air, but you can still see the interface. You can see the gut signature of the gastric wall here, right next to the spleen. So this is a common pitfall, especially with students. So get used to seeing a stomach. You know, oftentimes the stomach might be empty or full of gas and you won't really see it. But if it's filled with fluid, it's definitely going to show up while you're scanning the spleen. So be aware of that. Nice spleen-kidney interface. And then all the way to the lower part of the spleen, which would be about the midsection of the kidney. So just like in sagittal, you want to sweep medial and lateral on the spleen. In transverse, you're going to want to sweep from superior to inferior. Make sure you don't miss any lesions. This patient has this small structure here, which this is an accessory spleen, which is also called a splenunculus or a splenial. These are very common. In adults, you might not see these as much. In the younger patient populations, you'll see them quite often. I see them at least several times a week. So very common. So there's a splenial. After I'm done with that, I like to take linear images of the spleen. Sometimes you might have some inconsistencies of the parenchyma, especially if the patient has a disease like sickle cell anemia or spherocytosis. They might have a very heterogeneous spleen from edema or microinfarctions, or sometimes patients might have little microabscesses that you will only pick up with a linear probe. So I do the same views as I did with the curve with the linear, sagittal, medial to lateral, and then transverse, a few images as well. And then also I took a little clip of the little accessory spleen. So that's pretty much it for the spleen. A couple of the things you might want to check for is make sure you get good views of this portion of the spleen, superior portion, to rule out things like pleural effusion. Get both poles of the spleen very clear to make sure there's no ascites or any free fluid around the spleen, near the hilum, in between the spleen and kidney, or around the pancreas, which could be a result of pancreatitis. And that's pretty much it.